Okay, good afternoon, everyone, and welcome to the sixth annual Mental Health and Addictions in Construction webinar. So this is obviously our sixth one. It's our probably longest running webinar series. Um, and today's agenda is going to be jam-packed, and obviously we're going to get into the issues related to mental health and addictions. Um, First off, big thank you to the Ontario PC government. We've got two ministers represented today. And when you look back at their track record and the number of investments that have been made within health and safety, but specifically when it comes to mental health, it's just staggering. I think mental health has always been an issue, but I can't say that it's received the attention and the support that it has under this government. And from all that I can tell, the investments are kind of just starting. And so the idea is for today, we're checking in with construction, we're checking in with the members, we're checking in with the workers. We want to be very open and very honest about where we're at. And then specifically, we want to look at what we can do to improve. And so we can celebrate the success that we've had. We can celebrate the fact that we've done a lot to reduce the stigma, but we need to be open and we need to be honest that a lot more needs to be done. There are a lot of people that continue to suffer. There are a lot of people that are still looking for help. There's a lot of people who are afraid to ask for help. And when they do look for help, it's not a one size shoe fits all kind of approach. And so we're learning, we're evolving as an industry. And so again, we can celebrate what we've done, but by no means is this task done. We're still, I think, in the early stages. I would like to thank the ResCon Health and Safety Committee. They do look at the agenda and they provide a lot of guidance. They also provide kind of the eyes and ears on the ground. They're the ones who deal with this all day, every day. Also like to thank Yasmin and Meredith and the ResCon staff who helped put this on. And I'd just like to mention one, this recording will be made available and it'll be sent out to everybody in the audience. And two, we are trying to collect as many resources as we can on this issue. And so oftentimes audience members have excellent resources. And so please share them in the chat or email them to us because we do want to create that collection of resources and we want to get it out to everybody on this webinar, but also out to the broader construction committee. And so with that, I'm going to do a quick land acknowledgement, and then we're going to play a greeting from the Minister of Labor. So we respectfully acknowledge they were situated on the traditional territories and treaty lands, in particular those of the Mississaugas of the New Credit First Nation, as well as the Anishinaabe of the Williams Treaty First Nation, the Huron-Wendat, and the Métis Nations. As ResCon's office is located in Vaughan, we are grateful to the opportunity to work and live in this territory. And with that, we're going to play a video of Minister Piccini.
Perfect. So to kick us off today, we have the Minister of Labor, Immigration, Training and Skills Development, Minister David Piccini. He's a strong advocate for the skilled trades and specifically health and safety. So thank you, Minister Piccini, for sending over this video that we will share now.
Hello everyone, I'm Minister David Piccini and it's an honor to address ResCon's 6th annual Mental Health and Addictions in Construction webinar. First, a big thank you to the team at ResCon, the Health and Safety Committee and all joint health and safety committees across residential construction. Your tireless commitment to improving our industry makes a world of difference. Mental health and worker safety are top of mind as we continue to support the men and women who tirelessly keep our province running. We understand that construction sector presents unique challenges due to its demanding and high-pressure environments. The crucial role that health and safety professionals, HR managers, site supervisors, employers, and tradespeople play in fostering safe and healthy workplaces are vital to addressing these challenges. We need to remember to meet people where they are. Whether you're a site superintendent looking out for your team or a worker pushing through a tough day, it's essential to acknowledge and encourage open and healthy conversations. Let us use best practices to build mental health into everyday operations. Resources are available. From benefit packages to our government initiatives, our support is expanding, and we're working together to do it. Our government is here to continue supporting workers. Together, we can make mental health as vital and as visible as physical safety on every job site. So again, a profound thank you to ResCon and all of you attending today. Let's keep pushing forward, having those essential conversations, and making mental health and well-being a central pillar of our industry. When we support mental health, we support a stronger, more resilient, and healthy workplace. Stay safe and take care of each other. Thank you.
Perfect. Well, thank you, Minister Pacini, for your ongoing commitment to keep working with the construction industry and to make sure both our sites are mentally and physically safe. Up next, we have Dr. Joel Moody. He is the Chief Prevention Officer for the Ministry of Labor, Immigration, Training, and Skills Development. And if you've attended any of our health and safety webinars in the past, you know what a crucial role Dr. Moody has been to every single one of them. He's the public occupational health and safety leader with over 17 years of experience working in various labor organizations throughout Ontario. He's continued to make mental health central to his philosophy and leadership, and it's always important to keep up with the industry and province and what they're doing in this topic. With that, I'm happy to welcome Dr. Joel Moody. Thank you for being here and welcome back.
So thank you very much, and we'll say good afternoon to everyone. Always my pleasure to join you for such a critical conversation, mental health, addictions, and its impact on the construction sector. First, my thanks to ResCon for hosting this webinar and your leadership for addressing such an important and pressing issue. Want to echo the minister's comments, because we know that construction is an industry that strives on resilience, collaboration, and at the end of the day, hard work. But we also have to acknowledge that it's an industry where mental health challenges and substance abuse disorders do exist. They are prevalent. So the demands of the job, long hours, physical strain, high pressure, all those aspects can take a toll. So want to say today, how do we find ways to break the silence? Dismantle stigma, explore solutions that can really help save lives, that help strengthen our industry, strengthen our communities, strengthen our province. So I want to talk for you just a few minutes, kind of about the reality of the situation that we have. So you've heard some of the statistics. The studies show that workers in the construction sector are at a higher risk of mental health issues, depression, anxiety, substance misuse. And unfortunately, self-harm among construction workers significantly higher than the national average. For men, estimated 3 to 4 times higher. We know that substance use, alcohol, opioids, is often viewed as a way of coping or dealing with that stress, the pain, which further exacerbates the issue that exists. So why does it happen? Well, it's not as simple as one thing. It's a combination of many factors. We'll talk about high stress. The work that you do, you have deadlines, the physical hazards that exist, the fluctuating work schedules. That's your reality. When we talk about stigma, especially from a cultural standpoint, many times in construction, there's that tough it out mentality, I'm just going to shake it off. And sometimes having that mentality often discourages one from seeking help. Later today, you're going to hear from Mr. DeBolo talk about, access to care. We know that there is initiatives and tons of investments that the government is putting in place in order to address those gaps that have been persistent. Because sometimes it's even getting access because there's the fear of losing jobs. So a wake-up call. How do we find ways that we are addressing mental health and addictions? It's not just something that we do out of moral obligation, but it's essential from the standpoint of how are we sustaining our workforce? How are we helping to sustain each other? So let's do it. Let's turn that tide. Let's find ways. And I'll provide 3 pillars for thought: awareness, action, and accountability. So raising awareness. Let's break that stigma. Let's look at initiatives and campaigns that encourage people to have open conversations. You've heard the moniker that we do it a lot for physical injuries. You could see someone with a broken arm. You can see someone, that's not doing the same. But do we have toolbox talks that really focus on mental health consistently? How do we make that mental health as a normal topic as we talk about physical safety? The resources and the support. You heard earlier that when we look at HR professionals, when we look at our health and safety professionals, How do we find ways in order to implement programs that are of confidential natures and counseling and things so important? The partnering with organizations that look and deal with both prevention, recovery, and the ability to manage the day-to-day living with mental health conditions. And as well as what are the training and ways that we can help our supervisors recognize the signs of distress, the signs that are there. Not saying that the supervisors are there to diagnose or treat, but how do they provide support? Building that culture of care. We talk about a culture of safety. What about a culture of care? It has to be part of the culture. Not only is it about physical safety, but how do we find ways in your plans, your policies from an employer standpoint that are also very clear that the mental health is important. We always talk about negatives many times, but where's the conversation about celebration? I remind my staff, let's have fun with what we do. So recognize those individuals and teams who are your champions, who are promoting mental health activities in your workplace and well-being. And also encourage peer support. Sometimes that best work and help comes from coworkers because they understand, they're beside you. So at the ministry, we take a prevention-first approach when we talk about work-related mental health. And so when I was reflecting on this topic, it is a system focus within the current 5-year strategy that's called Prevention Works. So in 2022, we established the work-related mental health and workplace violence and harassment committees that worked with our occupational health and safety system partners to do a few things. We developed and how do we find ways to support and implement evidence-based programs, training, resources. So for example, we were able to create the thinkmentalhealth.ca website. And there it provides information, actionable mental health resources to help the needs, not only of workers, but the employers as well. Additionally, each health and safety association has developed sector-based resources and training support about psychologically health and safety workplaces. For example, our colleagues at the Infrastructure Health and Safety Association, IHSA, they have resources on work-related mental health for the construction sites and the trades. And our colleagues at the Occupational Health Clinic for Ontario workers, they offer a range of resources to support work-related mental health, to help workers understand and monitor work-related stress. In addition, I would be remiss if I didn't talk about how we work with our partners to address workplace risk factors for opioid-related harms. And this was done through our Workplace Naloxone program, designed to both inform and educate the construction workplace parties around why and how workplaces can take action to help reduce opioid-related harms amongst Ontario construction workers. This is our 6th meeting. Each of these conversations continue us on the path of better mental health. And in doing so, we all have a role to play. So employers, what are you doing to invest in your programs, mental health programs that foster an inclusive environment? The workers, are you looking out for your coworkers? We talk in the physical health and safety world about say something. If you see something, say something. Well, speak up for someone when you see that they're struggling. Industry leaders, advocate for the policies and the funding that prioritize the mental health and addiction support. You have great leaders. The government is here to listen and to implement. Because together we can build an industry where no one feels that they have to suffer in silence. We want to have a workplace where seeking help is seen as a sign of strength. So let's make that mental health and addiction support integral to construction as hard hats and steel-toed boots. So I want to say thank you very much for your time this afternoon and your commitment to this vital issue. We have to keep this conversation going. We must, not just today, every day, because together we will continue to build a safer, healthier, and more supportive construction industry. Thank you so much for your time.
All right, with I'm just adding the pin here. Perfect. Okay. Thank you, Dr. Moody. I guess you disappeared. I don't know what happened there, but thank you. There we are. Always appreciate your thoughtful words and the work that you do. It does jump out to me that if we were able to truly treat mental health injuries or mental health issues the same way that we treated physical health issues, I think that is the ultimate goal. I think we are making progress there, but as you point out, there's still a lot of work to do. I also think it's great that you come from the prevention office. I think we want to prevent all injuries, but I think specifically, the more you can do on prevention when it comes to mental health issues, the better. But anyways, really wanted to thank you for your leadership as well as your time. So thank you very much. Okay, and I think Yasmin or Meredith is going to start adding in the panelists. And essentially, we've got experts from across the construction industry here. And so we're going to invite the panelists to join us on screen. Perfect. Okay, maybe it was just my screen. I apologize. So we've got 4 excellent panelists here, and we're going to do our expert panel. And essentially what we're looking at here is the state of mental health in construction and crisis management. And so I'm going to go on my screen, and I'm just going to give you guys each about a minute to introduce yourself. And the person I see first on my screen is Kathy Martin from the IHSA. But I think you're muted, Kathy.
It's muting me.
There we go.
Okay, all right. Can you hear me now?
Yeah.
Okay, so my name is Kathy Martin, and if you've come to some of these sessions, you may have seen me before, but I'm the mental health and addiction specialist at IHSA, and yeah, pleasure to be here, and thanks for inviting me.
Perfect. And then I've got Carmine next.
Good afternoon. My name is Carmen Tiano, and I'm the Director of Occupational Services for the Ontario Building Trades. I deal with Andrew, Kathy, and most people probably on here on various committees. Mental health has been something that's been on our radar now since 2015. So I'm glad that I'm part of this for us to move towards a team effort to deal with this crisis, which is affecting workplaces and society as a whole.
And I think that is probably the appropriate use to word there. So it is a bit of a crisis right now. And so Sabrina, I've got you up next.
Thank you. I'm Sabrina Junior Romano. I'm one of the training and delivery specialists for Opening Minds and the Mental Health Commission of Canada. My background is social work, and during COVID, I was a supervisor on a crisis line. So I've always worked in the mental health field, and I think that more than ever, it's time to open the talk around mental health in different sites and different employments.
Absolutely. And then Melissa.
Hi, I'm Melissa Mercar. I am the Health and Safety Manager for Menkes Developments Limited. I've been in the construction industry for about 22 years now doing what I do. And I'm on the ResCon Health and Safety Committee. And a huge focus of mine, as Andrew is well aware, and ResCon is mental health. As a whole and within the construction industry, with everybody involved from management to workers to construction sites. So thank you for having me.
Perfect. And we've carved out a little bit of extra time for this committee because I think we're hoping to do a fairly deep dive and get some fairly good perspectives here and really give you guys an opportunity to share your expertise. But I am going to start with Carmine, and the first question is going to, I think, recognize the fact that you've been, working on this. I think you said collectively since 2015. I think we all know that you've been thinking and working on this a little bit longer than that. And so you do work very closely in our representative of the building trades. And so the question is, how has your approach, but how has the approach of unions really, evolved, I'd say, or changed over the last couple of years?
Yeah, thank you, Andrew. And thank you for everybody attending this, because up to maybe few years ago, pre-COVID, mental health was there, but everybody just kept it, like say if it was a luggage, you stashed it away somewhere that you didn't want to deal with it. But 2019 opened the eyes. But Andrew, what really got me thinking about this, there was a report in 2016 or 2015 from the National Institute of Occupational Safety and Health in the United States, which looked at men in trades and suicides. And then when I looked at the numbers in construction, I started to see, wow, 3/4 were related to opiate deaths. And then I'm going, wow. But when you looked at the actual study, in that study, there was buried of the correlation between substance use and the death and what was happening prior to that person making a decision to take their life, mental health. Then what happened was, all of a sudden, the world was hit with COVID. And then I'm going, okay, I know that now the genie is going to come out of the bottle, and wow, once it comes out, it couldn't. Well, then the building trades realized, okay, from our own internal documents and information through what was happening with the De Novo Treatment Center, which is it's union and it's unions and employers. It's a treatment center for construction. I saw that data. 2021, De Novo did this study through SDF funding, and they come up with these 5 drivers. The 5 drivers are extremely important because Dr. Moody brought them up. Work habits, between 44 and 49% of the 1,200 people that did this survey talked about work habits and schedules. Personal relationship, 45 to roughly 47% talked about the problems they were having being in construction with personal relationships. Stress and anxiety and depression came up 40 to 41%. So as of these 1,200 people, 41% said, hey, my actually job is stressful. Finances came up. The one that came up low, that kind of freaked me out, was discrimination and abuse, 24 to 26%. I personally think that would actually be higher for the idea of the stigma. Then what the building trade started to do. I think that's when I probably reached out, I believe, to Kathy the first time. And Kathy and I started to talk about this idea of substance use and mental health. And both of us are a big proponent of linking them together. So what we did the low-hanging fruit, right? So the low-hanging fruit was we did educational sessions around substance use with St. John's Ambulance. Key, we use partners. Then we did work with the Working Mind program to get more information. And as a result from there, we started to embed slowly programs within pre-apprenticeship and apprenticeship programs that basically provide information to people going into the trades. Hey, the same way you need to look after your physical health by wearing construction proper PPE, wearing a harness. If there's vapors, wearing breathing, you need to look at yourself when it comes to mental health. So we started doing that. But as we started doing that, we realized internally some of the supports through employee assistance programs may not actually be up to snuff. So what started happening is our unions started to provide more mental health supports via employee assistance, ramping up what was available for massage therapy, for musculoskeletal pain, because there is a correlation between musculoskeletal pain and the onset of depression and stress and mental health. And in the study that happened in Ontario with De Novo, the work habits remember how I said 44 to 49% of the people, they identified within that category physical pain to work involved. So we started to move to create an infrastructure. If someone is having issues, they can go to employee family assistance programs. But again, that's very low hanging fruit. Now, where I think we need to go, though, we need to get better. Yes, training, education is important. That starts to change culture. But at the same time, the parties, not one party, all the stakeholders need to come to an agreement that mental health, yes, it's affecting the workplace, it's a societal issue, and a lot of the supports people are going to need to actually come from other partners, i.e. government. That will be better access to counseling, cognitive behavioral therapy. Because if you look how much it costs to get a counselor, you're looking at anywhere between $150 to $200 an hour. Even unionized workers that are paid very well can't afford that. So there needs to be a look at that. Now, at the workplace, I think we do have opportunity with existing practices. So if you think about it, all of us look at the physical hazards and we follow the hierarchy of controls. Elimination, substitution, I think redesign, education, and I'm forgetting one. Now, if you're looking at stressors at the workplace, we already know that the literature indicates that in construction, there are certain drivers, and the drivers, it doesn't matter where you look. Ontario, British Columbia, California, San Francisco, the drivers are the same because the nature of the work is basically the same. When the de novo study came out with the 5 drivers, I conducted my own literature search. I think I looked at 45 papers that looked at construction. Lo and behold, the same drivers that were identified through the de novo patients cohort have been identified everywhere else. So we know what the drivers are.
And maybe we can get a copy of that paper too to share with everybody.
Yeah, I will.
Okay.
And what I did, Andrew, I listed all the resources and
Yeah.
then I put together a little chart and I broke down all the drivers. I'll share it. I think I shared it with Kathy and some other conversations we had. So you'll see what
Yeah.
happened. So
Well, I think it's an interesting what you said, because you got into it, you looked at the data, and then you let the data kind of guide you, but it sounds like the building trades have really adopted a continuous improvement model in the sense that as you get into it, you know that you're committed to it, you know that you're committed to a data-based approach, but you're kind of letting that data drive where you're going.
yes, because if you don't,
Mm-hmm.
you're not going to have a strategy. See, one thing I don't want to happen is this. I don't want, 2024, there is this strategy. 2026, you throw what you did in 2024 and you create something else. I think what you need to do is we need to say, hey, here's what we're doing. Here are the areas, and you just keep moving towards it. So if the first thing we need to do is, hey, why don't we look at the resources we have already available in Ontario? Now, in Ontario, what is interesting,
Mm-hmm.
unlike other jurisdictions across Canada and North America, we have a vibrant health and safety partnership that has not only the HSAs that provide fantastic work
Mm-hmm.
to the sectors, we also have a center of excellence program with other partners. We have research centers. We have the Institute for Work and Health. We have OCRC for malignant cancer. We
Mm-hmm.
have the Center for Musculoskeletal Disorders. And we have all these other centers that have been doing a lot of work when it comes to workplace, physical
Yeah.
injuries, and mental health. I think what we need to do, as part of whatever the strategy is, harness those resources, create the compendium that's there. Then the HSAs can take what's already been said in the research, put it into practical information, give it to the employers, because most of the employers are small in construction, less than 20.
Absolutely.
And then we start by using the hierarchy of controls. What do we look at the workplace to eliminate a psychosocial hazard? You know,
And so I'm going to come back to you, but I'm going to try
yeah,
and bring some other people in here. So
right,
I'm going to go to Kathy because I think you mentioned the HSAs and you certainly
yeah,
mentioned data and training. So to bring Kathy in, so
sorry.
obviously there's a huge need for training. You guys are doing a lot of it. Can you talk about some of that training? But then also, can you talk about kind of the evolution of what you see from the attendee, if that makes sense. So what was an attendee like as these programs started? And are construction workers and attendees approaching the training differently in 2024?
So I think I'll flip it. I'll answer that part first, and then I'll talk a little bit about some of the new training and how we're hoping to change maybe what I'm going to say first. So, in working with Carmine and others in the industry, certainly strategy is a big piece of that. And training as Carmine mentioned, is part of the strategy. And when I first came on with IHSA, it's been maybe close to 4 years now, in May, there wasn't a lot going on, to be honest. And when I started talking with industry folks and bringing health and safety reps to the table, start talking about it, the health and safety reps, it was like news to them. Like it wasn't like news that there was a mental health problem and substance use problems in the trades. It's just like news on how do I deal with this? What I have no idea how to build a strategy. So working with them from the high level, trying to get them just understand of what they're going to be jumping into, because I think Carmine articulated there's a lot there. There's a lot of moving pieces. So I've been taking a really cautious approach with approaching the industry as like, you need to build a strategy. You need to understand what you're getting yourself into. Yes, you can pull the low hanging fruit and you have safety talks and some other things. But when you start building out your strategy, some of the first things you need to do is start training your managers and supervisors and people leaders. They have to have the skill set to start the conversation, because you can say, oh, start the conversation. But if you throw two people in a room, or, an untrained supervisor to have the conversation, you can actually do some more damage than good. So I'm always very cautious. Like, worker training should come later in your strategy, and you need to prep the workplace first. So we have been working hard to get some of that really good, robust management, supervisor, people leader training in place. So one of them, Carmine mentioned, is the Working Mind for the Trades. We heard from the industry, many were using that program, but they wanted to see it customized specifically for them. So we went ahead with the Mental Health Commission through the Opening Minds, and I'm sure Sabrina will touch on it a little bit. We did customize that program, and it is up and available and ready, and we've been launching that. And so what we're seeing is a slower uptake than we had hoped, to be quite frank. But we are excited about when people come. It's like that light bulb moment. We're seeing the light bulbs go off. We're seeing them understand a little bit more that when we're talking about these issues, we're talking about a couple different pillars. We're talking about workplace, like mental health at work, and managing mental health and substance use at work. But we're also talking about those psychosocial risk factors and some of those things that are impacting our mental health, which goes to some of what Carmine was talking about, the stress, the stress on the job, and all the things that work does to us all, right? How do we manage that from a systems level? So they're understanding, like, we got to do that. So we have this great new program. It's up and available. It's for managers and workers. And right now it's free for a limited time. And we have our 2025 schedule out on the website. But we also have just soft launched a new program called the Opening the Door to Support.
I think we're starting to have trouble hearing, Kathy. I don't know if something changed with your microphone.
Sorry,
Yeah.
Is that better?
It's still
better?
probably a little late, but
Oh, okay. Oh, just a sec. I have hearing aids. Let me pull them out.
okay. And maybe while you're fixing the mic, I think we started talking about programs and different training. I don't know, Melissa, as an employer, obviously you're a user of training programs. How has, in your mind, training kind of evolved over the last 10 years? I guess I'm guessing 10 years ago it wasn't a topic, but I mean, I'll let you kind of jump in and answer.
Training with regards to health and safety it's still an ongoing issue that needs to be addressed and needs to have focus. I'm still finding I'm more on the construction projects with the workers. I do work in the office in the corporate field as well. But from a construction site perspective, what I was going to touch on was I think more employers from a management standpoint, union representatives, different organizations like the IHSA need to come out to these construction projects and need to speak to these workers in person, because I don't feel that the employer is maybe not getting enough information, but then relaying it to the workers and taking the time to speak with them and to discuss in detail what's available and to talk about the concerns that they may have. And I find that I'm still meeting individuals that are reluctant in talking about their mental health and illness that maybe they have been diagnosed with, because it's still a topic where if you say, well, I have a mental illness and I suffer with depression and anxiety, it's a stereotype. And it's still being that type of concern where people, they don't want to be centered out. They don't want the focus on them for all the wrong reasons. The bottom line is people need help. People are struggling and it's a serious concern. And the issue I'm finding more and more is nobody's taking the time to talk to the workers that are in the thick of it, that are dealing with the stress, dealing with everyday construction industry environments. And they just want to be heard. They just want to be seen. They want to be recognized. And that's where I set the time aside and I focus on that. And when I open up about my own personal mental illnesses, then they're more comfortable in opening up and discussing with me and just showing that you care. That's a huge thing, not only in the construction industry, but worldwide, is we need to lead with love and kindness. And I think that's been thrown out the window since COVID. Nobody wants to look at each other. Nobody wants to talk to each other. And I just feel, and I constantly say it even to my children, we need to be mindful and respectful with how we speak to each other, because you don't know what's going on in each other's lives. And it's extremely important because words hurt. They go very deep and it can definitely build up and it can become fatal when you're dealing with mental health. And I don't think a lot of people really see that. But I've seen it more and more in construction, and especially because we do high rise. I've had a couple of situations in, I would say, the past 5 years where people have wanted to jump off the roof of our condos because they know what the outcome's going to be and they're going to solve all the issues that they're currently struggling with. And thankfully, it hasn't occurred. We've been able to talk them down and get them the help that they need, but they just want to be heard. It should never get to that point. So that's where we need to, like Kathy was saying, and Carmine, people need to be trained in how to recognize these signs and to know when someone's struggling. It's
And
extremely
maybe
important.
we'll try to go back to Kathy, but I think you made some very good points. Even just construction's an in-person business, and if we're really going to implement this, it's got to be done on the ground, and it's got to be done the same way that we do on the job training. You know, this is the same as a technical skill. And so we'll go back to Kathy because I know you didn't get to finish your point there.
Yeah, no. That's great points that Melissa brought up, and I think one thing I want to, kind of respond to is the bleeding need to have people with boots on the ground able to have these conversations. And back to what I was saying, this new program that we've launched is designed specifically to try to get some of those skill sets, at least skill sets and awareness and the thinking going, because it's about, it's really about behavior change. And if you're not even pre-contemplating it, we got to at least get people to the contemplation stage where they're actually hearing something and they can contemplate on how they might want to engage and challenge their own biases and stigmas around a lot of these issues. But we need people with boots on the ground skills to be able to have those conversations. I just say I'm one person. I certainly can't go out to all the construction sites and have these types of conversations. I'm here, from a systems level, trying to build a system in place where the learning can happen for those behavior changes to start to take hold. So, around the stigma and the biases. So having training like the opening the door and to support, as well as the Working Mind program, are just two great places to start. But it's a start. And it goes back to my first comment. We need a strategy. We can't just jump into this blindly. It's got to be part of a system. So, adopting the CSA standard for psychological health and safety so that you're building a management system around this is critical. And small businesses can do that. There's different levels of adopting the standard. There's a new ISO standard as well, 45003. Those will all be in the resources as well. We need to, so if you're out there listening, you need to make that strategy first and foremost and get your ducks in a row. I just say I am there to consult the industry, and I have been doing that. So what have I been up to this past year? I have been doing more and more phone calls, one-on-one consulting with people who are ready. Those who are ready to take the steps, they're ready to listen and start building out those strategies. Those that are inquiring still, they're coming to the training. They're saying, okay, yeah, interesting. They're we have a lot of NCSOs, which are the National Construction Safety Officers, and NHSAs. They just had their annual conference and listening about stigma, and so we're trying to train the champions. Once the champions can take hold, they get into their individual organizations and workplaces. They make the strategies. They build out the implementation plan, right? For the training to happen. So until we do that, we won't really shift the culture. And I just say
Maybe this is a good kind of segue into Sabrina, and maybe you can tell us about
absolutely.
Open Minds and your organization and some of the great work that you guys do.
Absolutely, thank you very much. We are kind of a peculiar organization because we touch on mental health with all kind of different age group, different places where you live in Canada, because the reality of us in the South is very different from people in the territories. And then the Working Mind has, and COVID really helped in a way with that, where we adapted it to different sectors, different industries, because we did recognize that the mental health challenges for each industry are very different. But our main point is to make sure that we have enough programs. Some of our programs, like the Working Mind, which is more proactive. So it's more around how to even talk safely about mental health, because as long as we don't educate and as long as we don't give the tools to workers, again, in all kind of different industries, on how to open up about your own mental health, but also how can you go and talk about mental health to one of your colleagues just because you're worried. How can you talk about mental health openly with your employees when you are a manager and you want to make sure that they can talk, they can share with you how they are feeling without having the fear that they are going to lose their job? Because that's still a reality today because of the stigma. And so the Working Mind, and I was so happy that we could actually create the Working Mind trades, because we did recognize while creating it that in Canada we don't have a lot of statistics around the mental health of trades workers, and so we had to look somewhere else. So making sure that we can recognize what makes the trades like a very different place to work, and what makes their mental health also maybe a bit the challenges maybe a bit more different. So it's really to educate, give you tools. Again, it's how can we speak safely around mental health. And I always say, as long as I feel safe in the conversation, I have more chances of making the other person feel safe as well. And I don't need to have all the answers. It can just be like, hey, I can be your shoulder today. I just want to make sure that you are going to be okay. And then we took it a bit further with mental health first aid, where we can actually really help someone recognizing the signs of a declining in the mental well-being, but also if there is a crisis with one of my coworkers or one of my employees, crisis or an emergency, what can I do? How can I actually help? How can I interact with the person, but also with the coworkers, making sure that everybody feels safe. And we took it even a bit further with our psychological health and safety trainings, where it's really to have a look on the individual mental health, but as well as the workplace mental health, but as a whole. And we offer training, assessments, services to actually integrate psychological health and safety into the everyday operations. So it's free for all our courses are for the employees, but also for the managers and the directors, because I think we all need, like, it's all of us together.
Yeah, and I think what jumped out, I mean, obviously there's lots of good work going on there, but it seems like there's real value and real benefit in somebody just being able to kind of, I don't know if the right word for it is unload, but essentially unload what they're feeling and thinking, and have that person not turn around and be like, oh, well, you're too much, right? And so just understanding the value of having somebody to listen in itself seems to be a huge step going. Um,
Absolutely. Yeah.
mhm. So to bring it right back to the site level, um, there's more resources today than there's ever been before. Is it making a difference on the site? And I'm going to start with Melissa.
It is, given that it's presented by the right person, I feel, and that we ensure that it gets out to the workers. Because I'm still seeing, when I walk around the site and I observe, that people are one track, they got a job to do, they got a schedule to meet, and they're not taking the time to do the basics that we learned as human beings, and that's making eye contact. And when you walk by someone, you say good morning, good afternoon, how are you? And I think we need to remember that we're all human beings, and it takes a minute out of our daily lives to just appreciate one another and talk to one another and just kind of unwind, so to speak, and reset from our busy everyday schedules. So I'm definitely open to having people come to any of our projects and speak with any of our construction personnel that are
Yeah.
situated on the site, because I think it would go a long way. Like I had mentioned previously, it needs to be in person. And it should not escalate to the point that someone needs help now. And they should be aware of the resources that are available within the construction industry, or what they need to do if they're struggling, and the steps that they should take from a medical standpoint and seeking medical attention. So yeah, I'm definitely open to talking with Kathy further, and Sabrina. And it definitely, I know, Kathy, you won't be coming out, but someone will. And yeah, just walking around the site and introducing them to the workers and talking, and they just want to feel appreciated. They want to
Yeah.
feel recognized.
So the resources are there, but we really got to focus on implementing.
Yeah, is getting it out
Yeah.
there and communicating
Yeah.
everything with the people that are struggling and letting them know that they're not alone and it's okay to not be okay and that we're here to help you. That's what we want to do.
Yeah. Okay, so I'm gonna ask you the exact same question, Carmine. So we've got more resources, and from the union's point of view, from your point of view, what is that doing for workers on site now that we've got we've more resources than we've ever had? What's the impact for the on-site worker?
Yeah, I think some of my colleagues may disagree with what I'm about to say. When I said that we pick the low-hanging fruit, I think the resources just got us to the fruit we can pick. We haven't gone up the tree. One thing that I've come to the realization is that the resources alone, unless the workplace ancillary policies allow for the resources to work, it's not really making that much of a difference. I'll give you an example. I had a worker calls me up. I deal with this employer all the time. Worker said, "Hey, Carmen, I'm having some issues. I know that there's been training down in my workplace, but because of the supports within the workplace, there isn't a strong culture of duty to accommodate." Worker reaches out that Carmen has a problem, reaches out to this employer. The easy thing to do is we'll just give you a medical layoff. And then when person goes off and did his treatment, coming back was very difficult to get that person back. So my thing, we need to look at not only the resources, do the ancillary supports at the workplace and the union support someone reaching out, requiring an accommodation following treatment or during treatment. Are we receptive to it? I can tell you, not all union reps are receptive to the idea of an accommodation of someone that reaches out with a mental health. So I think, the supports don't exist in a vacuum. Like, that's what I think we need to look at. My opinion, anyway.
Okay. No, and I appreciate that, and I appreciate the honesty. So we're gonna do two things, and it's gonna be tough, because I'm gonna try and limit everybody to about a minute. So I'm gonna ask two questions, and you get about a minute to respond to each.
So don't ask me then.
Yeah. So the first one will be,
Yeah, he's out.
imagine you had a magic wand and you could change one thing in this space. What would it be? And if you could limit that, I'll be even more unreasonable. If you could limit your answer to about a minute, that's even better. And so we'll start with Kathy. We need you to set the precedent here, Kathy.
All right, magic wand for the future. I think Carmine's analogy of we haven't started climbing the tree resonates with me. So I think we all need to get a better bird's eye view, and that comes back to the strategy. Those who are ready to take this on from an employer standpoint, get the help you need. Go to the opening minds, take the auditor course. There's so much training to train people to do this. Get trained, get somebody trained so that they can train the people to have the boots on the ground.
So your magic wand is to have people take the training.
Take the training, but not just that. Get a strategy. Start thinking about this more strategically. Review the standard, psychological health and safety standard. It's all there. That's the magic wand right there.
Yeah, I
If
see a
people
lot of
actually
nodding from Sabrina. So magic wand moment. What's your magic wand moment?
I'm gonna link mine to Kathy. I would reduce stigma, and I think by talking about mental health and actually getting trained into talking about mental health as openly as we talk about physical health, that would be the first step. That would be so helpful, because when we talk about return to work, and I would link that to Carmen, as just, if you are scared about talking about your mental health, going back to work and having to ask for an accommodation for your mental health that we don't necessarily understand is the hardest part, which is why people tend to not go back to work. So
Mhm.
stigma,
And we
I
will
think is
cover some of this. We've got a legal presentation coming up because obviously construction is distinct. It's
yes.
recognized as transient. It's a different form of employment. So, but I think linking the two, physical and mental, that would be worthy of a magic wand. So I've got Melissa up next for her magic wand.
I'm going to go back honestly to the basics of just being a human being, and that's leading with love and kindness and showing that you care, and being mindful and respectful of others and the people around you with how you react, how you approach people, how you just handle everyday life, because you know what? It goes a long way.
Mhm. Carmine, magic wand.
Yeah, I would basically move to what I call a total worker health approach. Okay?
Mm-hmm.
That you put everything to the total worker health, Carmen's physical health, and in those programs, you look at Carmen's emotional health, how Carmen deals with his actions outside of work as well. In the total worker health model, we can go down fit for duty policies, accommodation policies, etc. So that's what I would really want our system to change the paradigm to.
Yeah, no, I think those are good. And as a moderator, I'm not really supposed to give an answer, but I can't help myself. I think if there was one thing that I would change, it would be that when somebody's ready, the resources are ready because, you know, there's been a massive improvement
Amen.
in the number of resources available, but the problem is 5 minutes is too long. And whether it's a death on site or even, you know, I want to see a counselor. And because if they don't go in the next, you know, 24 to 40 hours, they might not want to in a week. And so I know I'm not supposed to jump in like that, but I had to. So the way we always end this panel is we give each speaker an opportunity to kind of give their final thought or to give the audience a takeaway. So what is one thing that you'd like the audience to remember kind of from this panel? And we'll go reverse order. So we'll start with Carmine.
Yeah, I think one of the biggest things that no individual union or employer is going to solve this issue. It's not an I situation. It's a we situation, and we necessarily don't have to create new entities to fix it. We have a lot of good entities within Ontario's Health and Safety Partnership. The other thing that I'm worried about, please, I don't want parties making money off the suffering of your workers and your members. The Mental Health Commission of Canada is reputable. They have great work, but you're going to have all these other fly-by-nights coming to you. Here, give me the X amount of money and I'll create a program. I don't want to create a cottage industry on mental health and suffering.
No, I think that's a good one. You got good resources, and we should be using the existing ones, and then funneling the investments to the workers on site. I think that's great. So we'll go Melissa for your final thought.
I would say just speaking up and coming forward. If you are struggling, let someone know and get the help and try and get the help that is needed. From a medical standpoint, from even family as a strong support system. If you recognize that someone you work with or care about or live with is not acting themselves, ask the right questions, see what's going on, pull it out of them, and let them, so to speak, release and open up to you. And then hopefully you can point them in the direction that they need to get the help that they need and to continue to do so, so that they don't feel the last resort is taking their life. Because it should never get to that point. There's so much help in our world. I know it's not easy sometimes because getting counseling, psychiatric help is very difficult right now with the rise, but it's out there. And if you need it, speak up and don't settle for anything less until you get that help.
Yeah, and I like how you said pull it out of them because sometimes you'll ask someone who you know is not doing well, but you've got to ask more than once, which is unfortunate.
That's like when your husband or your spouse asks, "Are you okay?" "I'm fine." Well, you know you're not fine just by the way you respond. So you have to ask the right questions, and this goes
Mhm.
back to Sabrina and Kathy being trained to ask those right questions when a red flag is presented.
Mhm. And then having the patience to stick with it. So
Yes.
okay,
Yeah.
we'll go to Sabrina now for her final thought.
Be the change. I think we need a few people to actually activate the change in how we talk and how we treat mental health, even more so in the workplace. And so be the change, be the one person that is going to be able to talk about mental health and to be actually there completely, regardless of your position, employee, manager, director. It's all the same. It's be the change.
Mhm. So we do have like an extra minute, and so I'm going to kind of ask a follow-up question there, Sabrina. So let's say you're an HR manager, you're site super. We just heard you say that. With respect to open minds, walk us through what that is. Like, who do they call? Who do they reach out to? Like, can you just let the audience know right now, like, how could they specifically, even, as soon as this webinar ends, work with you or work with your organization to start getting the help they need?
Absolutely. You can email us at solutions@openingminds.org. We'll have a chat with you to know exactly what are your needs. Would you be more the working mind for trades because you think that that's the one you need? Would you like, because I've worked with the mining industry, and I know they started, before starting with the working mind, they wanted to start with mental health first aid because they did recognize that there were more and more and more, they had employees in crisis. And so they wanted to be more equipped, at least the supervisors, more equipped to be able to answer those crises. And now we are working with the working mind trades, which is phenomenal for me to recognize that they wanted all the supervisors to be trained in one training first, and then having the employees trained in another one, because they wanted to slowly be able to work around the stigma and combat the stigma that the employees had themselves. And so to see that some companies are really working, it might be a slow start, as Kathy was saying, but for me, just like a few employees trained is always a win.
Absolutely. Okay, and the final word goes to Kathy.
I think you made the final word. I have to echo all of my panelists, co-panelists here, but with everything that they've said. But I guess the one thing I would leave is you've got to be patient in all aspects of this. There's systems changes that need to happen. Those don't happen overnight. This has been a conversation in Canada, workplace mental health, for a couple decades now. Our society is shifting, but it takes time to really shift culture. And the second thing I would say is we need to not only talk about mental health broadly, we need to talk about men's mental health. There's some and because we're highly male dominated, we need to talk about women's mental health as well. But because we're so highly male dominated, there's some very unique challenges. And so when we are talking about mental health, we have to keep that front and center as well, especially when it comes to the stigma. There's a lot of stigma there, not just around mental health, physical health, pain management. The tough guy bravado is something hard to chip away at, and we need to do that.
Yeah, it's a cultural issue, and it's a culture of
It is.
safety, and there's still work to be done there. So with that, though, unfortunately, we're out of time. And so I'd like to thank everyone for their thoughts on the panel. And I think we're going to turn it over to Diane, and I just got to figure out who's going to introduce them. So I think it's Meredith, right? Yeah, so I'll add Meredith. Perfect.
Yes, thank you. Thank you everyone for that wonderful panel. It was definitely very impactful. It always is. So next we're going to move on to our legal update from Diane Laranja. She's from Filion Wakely, and we love working closely with her all the time. She is always a great person to give this presentation. So just a quick introduction to Diane. She's a leading lawyer in labor, construction labor, and workplace human rights. She advises on all workplace matters, including labor relations, human rights, accommodation, and health and safety. So Diane will be accepting questions at the end of the presentation. So please use the Q&A function if you do have any questions, but I will pass it over to Diane and allow her to share her slideshow as well.
Thank you, Meredith, for the kind introduction. And hello to everyone joining us today. I'm excited to be able to contribute to what sounds to have been an instructive and helpful conversation so far. I'm going to spend the next little while applying the legal framework to much of the same concepts. I want to pick up on one concept in particular with the concept of compassion. And one of the decisions that we're going to walk through later on deals with relapse specifically, which I know has become more and more of an issue, and sort of what are the obligations that may exist when someone has successfully completed a rehab program with or without conditions, and one of those conditions or the expectations in the workplace has been violated. What type of obligations exist in the event of a likely relapse? And so without further ado, I'll jump right into it. I'll start with a brief introduction of the legal framework because I know many of us already have a good sense of what that legal framework is and the legal obligations. But then I'll also focus on drug and alcohol testing and the circumstances in which we may conduct a drug and alcohol test in the workplace, and what the duty to accommodate a substance use disorder looks like or may entail or require, and then end off with some best practices. Before I do, am I able to see or share my slides in any way?
Yes, you should be able to share them.
Okay, great. Let me do that. Pardon me here.
You did have it up, but now it came back
Did I
down.
have it up? Okay. Oh, no, but if I do that, give me a second. I
No problem.
apologize. How's that?
Yeah, we can see it again now.
Okay, I apologize. I think you can see the entire part of it, but onward. I'll be walking through a lot of these concepts. These are more so to reference the concepts that I'll be talking about. But it starts, I think, many employers are, of course, in the construction industry, naturally focused on the health and safety obligations, and that's with good reason. There's obviously significant penalties and exposure that exists under the Occupational Health and Safety Act. And the obligations, both for the employer but also other workplace parties, are quite stringent and quite onerous. And that applies as well with, allowing or condoning the use of substances in the workplace. Employers, as we all know, are required to take every precaution reasonable in the circumstance for the protection of a worker. And given the physical demands and the nature of the construction industry, there's of course many health and safety concerns or assessments that have to be completed, and that too includes an assessment on substance use or misuse in the workplace. Workers too have an obligation or obligations under the Occupational Health and Safety Act. Not, I'm not going to suggest that it's often pursued, particularly in a multi-party incident, but certainly there are obligations that are outlined for workers to report any contravention of the act, but also the existence of any hazard. So if, for example, there is a crew of 2 or 3 and one of the workers can observe somebody who may be under the influence or is acting uncharacteristically, there could be an obligation to report that hazard to the employer and to the supervisor. And of course, for an individual obligation, a worker's to not use or operate any equipment or machine or device or a thing that may endanger himself or another worker. And so I do like to start with that because I acknowledge, I certainly appreciate that in the construction industry, that is first and foremost on many of our minds. And as I say, with good reason. The Other side of it is that those serious and quite proper obligations are, of course, to be balanced against the obligations that an employer also has under the Human Rights Code, which is to not discriminate against an employee on the basis of a disability. The Human Rights Code protects an individual from discrimination on the basis of a disability that includes a substance use disorder. And so whether it's alcohol or narcotics or over-the-counter drugs or medicine or cocaine or many of the other substances, that may lead to the diagnosis of a substance use disorder. And if there is a disability, there's, and I should say, there's the potential for a disability on the basis of a substance use disorder. There is also the potential for impairment as a result of taking medication for an underlying condition. So for example, if somebody has an underlying back issue or a neck issue and they are taking a certain type of medication that may result in impairing effects, there is an underlying disability that attracts protection under the Human Rights Code. And what that protection looks like is that an individual with a disability is entitled to accommodation to the point of undue hardship. Now, we'll talk a little bit about what undue hardship looks like, or the limits of undue hardship. It is not a limitless exercise. And in fact, one of the key factors for whether or not you've met that point of undue hardship is health and safety. So there is an obligation to accommodate that does involve a burden, whether financial or otherwise, but it's not limitless. There is this point after which an employer is not expected to accommodate. And that point is driven by a number of factors, which we'll talk about, but includes health and safety. And so that provides some degree of assurance to employers as we often go through these instances where if we are butting up against a health and safety concern, and I'll say a real and a demonstrable health and safety concern, then that's where we start engaging with that undue hardship limitation. I also like to highlight that under the Cannabis Act, as someone, an adult over the age of 19 can buy and be in the possession of cannabis in an enclosed workplace. That's not to say that we can't limit the possession of cannabis in the workplace. And they also cannot, if it presents an unsafe environment, then there's limitations in the Cannabis Act as well. But I say this and I add this because this is sort of the reminder for everyone to go back to their drug and alcohol policies, which if you've been to these seminars before, you would have heard us talk about repeatedly. We should all have a drug and alcohol policy in place. That policy should be including the health and safety concerns, the accommodation obligations, the testing methods or when a test may be conducted. But it should also recognize the updates, of course, that have been made to cannabis. I see a number of times the possession of illegal substances to be understood or assumed to include cannabis, but that's no longer the case. So cannabis in particular requires us to obviously return to our policies and ensure that when we are prohibiting, say, the possession or use of illegal narcotics or substances, that there's also specific reference to or contemplation that cannabis is no longer illegal. So I want to get into drug and alcohol testing. And drug and alcohol testing is, I think it's not a new concept to many of us. And the idea is that the drug test needs to provide a real-time assessment of whether or not an individual is impaired. And the idea then being that that impairment no longer allows them to perform their job duties safely. And so because that is the test, is this a real-time and accurate assessment as to whether or not someone is impaired? We have to think critically about the method of testing. I think a breathalyzer for alcohol is seen as ideal because it does meet that test when it comes to accuracy, when it comes to it providing a real-time assessment, and that the method matches what we are looking for, which is alcohol. But whether it's a urine test or a oral fluid test, depending on what you are testing for, the results may not be an accurate indicator about that person's real-time assessment of impairment. And so we are, through time and through many of these decisions, and through mainly the use of and guidance of experts in this area, we are getting a general understanding of what test is useful for identifying which substance may be in someone's system, or at least, may be causing impairment, not just that it's in their system. But again, going back to our policies, but also our practices when it comes to testing, we want to make sure and think critically that we are using the appropriate testing method in order to get that real-time assessment. Now, drug and alcohol testing is usually reserved for safety-sensitive positions, particularly if an individual is working on their own or with little or no supervision, or of course with equipment or machinery that a level of impairment could place them in a dangerous or an unsafe situation. And in those types of environments, usually there is a general understanding or acknowledgement that in certain circumstances, which I'll get to, a test is appropriate. Again, that test has to be able to measure actual impairment. And I wanted to add that a positive test doesn't automatically mean that an employee has a substance abuse issue or a substance use disorder. There's, certainly recreational users short of a disorder. And I raise that because, interestingly, and it doesn't come to everyone's mind all the time, is that under the code, a disability includes either an actual disability or a perceived disability. Okay, and that's important, and I see happen in instances of testing. If an individual tests non-negative on a test and is immediately referred to a rehab program as a condition to return to work, is immediately subjected to random drug testing upon that return to work, is immediately placed on a last chance agreement, or is otherwise treated like they have a substance use disorder. All of those examples are very much forms of accommodation that we provide and that we're sometimes obligated to offer. But if we jump the gun and do it immediately, even if that employee does not have a substance use disorder, but is effectively treated as one or characterized as one, that too can bring a claim of discrimination. So I say that knowing the difficult predicament that places employers in. I'm not blind to that fact. But I raise it because of the importance for, in the instance of a positive or a non-negative result from a drug test, the importance of the employer to engage with that individual and their union representative about the circumstances leading to that non-negative test, and to provide an opportunity for information, including whether or not there's medical information that needs to be considered that, say, reveals a substance use disorder or doesn't. I think the response will very much and quite properly be different if an individual reveals the substance use over the weekend done on a recreational basis versus and coming to work impaired versus someone who is struggling with a disorder or may not know whether or not they have a disorder. So I say that to highlight that a non-negative test shouldn't get you immediately onto the path of, you know, a rehabilitation program or other different treatment programs. It should start a discussion with the individual. Now, when it comes to the circumstances in which a drug test can be conducted, there's generally 3 instances that are accepted. The first is if we have reasonable cause that someone is impaired. So this is if a worker attends work and they're exhibiting characteristics either in their speech or their look or in the statements that they're making, that there's reason to believe that this person may be impaired, then document those observations, be specific in those observations, and then that leading to a reasonable cause test. Where we often see it is following a safety-related incident, an accident, hitting a pole, or dropping a toolbox from a scaffold, or other types of incidences where an investigation leads itself to the idea that this person may be impaired, then having a near miss or safety-related incident cause a test. And then the final one is if an employee returns to work following a violation of the drug and alcohol policy or say a rehabilitation program, we often have conditions put in place that subject them to random drug and alcohol testing, but for a limited period of time. It's not meant to be in perpetuity. There is, say, a 6-month or 2-year time period where that individual may be subjected to random drug and alcohol testing. I say briefly, because I know it comes up, or at least I'm asked about random drug and alcohol testing. That is a much higher threshold to meet. And I'm talking not just random drug and alcohol testing for an individual. I'm talking across the workplace. Not to say that it's impossible. There are cases where random drug and alcohol testing is permissible. That's particularly in cases where the employer is able to demonstrate, 1, the significant workplace risks and the consequences, but 2, and this is, I think, the more difficult one to demonstrate, is that there's evidence of substance use in the workplace. Employers will say, well, I don't want to wait to accumulate that evidence. That's not something that I want to do, which I note, but that has been the test that's been brought, that has been adopted by the courts, is that there has to be some evidence of substance use in the workplace in order to justify randomly testing everyone. I should say that this specifically applies to unionized employees, not necessarily unionized employees, non-unionized employees, but certainly for the unionized environments, the threshold for random drug and alcohol testing is quite high. I wanted to bring up one fairly recent decision, which highlights where I think a number of employers, are on the right track, could even sort of get there, but because of some procedural steps that weren't taken, lose the opportunity to rely on a non-negative test. And when I say lose the opportunity, what I mean by that is there are instances, and I think rightfully so, that expose individuals to discipline or to a response from their employer if they attend work or are working impaired. And that may be challenged in the grievance procedure. And the employer then is required to demonstrate the reasons for that discipline, which in these types of cases depend on the non-negative test result. But in order to rely on that non-negative test result, the employer needs to demonstrate that it obtained that result properly. And so in this case, the employee was involved in an accident where it wasn't a particularly dangerous or damaging accident. He sort of reversed a vehicle into a trailer hitch. And you could sort of see that that had happened because there was a pylon there that went missing, and you could see the truck was more forward than the others. But as I say, there was minimal damage and no injuries. And a supervisor observed that there was likely an accident, or that this vehicle had hit the hitch, and informed the owner of the site. And the owner said, well, who was driving that truck? And when it was identified to be this individual, they said, well, give him a test. And so off he goes, and he conducts a test in a site trailer and is a non-negative. And so then he was suspended for 3 months after that test. And the union argued, the IBEW argued that the employer, even though the owner of the site demanded a test, the employer should have conducted an investigation to determine if there was any other cause for the accident. And there needs to be some reasonable line of inquiry that leads to the need for that drug and alcohol test. And here, and the employer argued, well, the client asked us to conduct the test, and that the policy allowed, given that there was this incident, to immediately conduct the test. And essentially, the arbitrator disagreed with the employer. The arbitrator said, look, when we're balancing, yes, the health and safety on one side, but the employee's privacy rights on the other side, it can't be that every single incident exposes an employee to a drug and alcohol test. There has to be some level of investigation and a suspicion of impairment in order to justify that drug and alcohol test. So, the sort of knee-jerk reaction to send him to a test didn't allow anyone to identify, was there a malfunction? Was there a brake issue? Was there, in fact, an accident? What happened? What were the reasons for it? Getting his viewpoint on the accident. And only when that is done, and if there's a reasonable suspicion of impairment, then can you move to the near cause. And so I highlight it because I think it's understood and it's correct that you can conduct a test post-incident, but that's not to say that there's important work that is done before that, which is that you have to first identify if there is an obvious alternative reason for what happened. And if there is, then the drug and alcohol test may be excessive. But if there isn't, and it's, let's say, for example, there's no obvious reason why it happened, or based on some comments you've gotten from others who witnessed it, there's a suggestion of impairment. But usually it's that there isn't any sort of valid explanation for what happened or the incident, then you can lead to yourself to a drug and alcohol test. And the consequences can be significant, right? In this case, the employer suspended him for 3 months. But at the arbitration hearing, the arbitrator, because of how they obtained that result, didn't allow the employer to rely on that drug test. So the employer was left with no evidence that justifies discipline. So it's I think a fairly important sort of policy or practice for us to adopt, which is what type of investigation will you be conducting, even in the instance of a post-incident? And our policies should be accounting for that. Our policies should be articulating and that an investigation will be completed, and that a test may be requested if that investigation views it necessary or appropriate to do so. So I want to get into the duty to accommodate. And as I alluded to earlier, we have the duty to accommodate an employee to the point of what's called undue hardship. And the factors that we think about that meets that threshold includes, as I mentioned earlier, the health and safety of the accommodation, not just to, it can include that individual, it can include other workers, it can include, the people who may be in the same workplace, whether employees or not. But it also looks at financial costs. This also can include the impact on other employees, the size, the operations, et cetera. It is a multifaceted consideration. Unfortunately, not an easy answer. It does often require a detailed assessment and to some extent sort of a guess as to whether or not you're at or beyond the point of undue hardship. But it is a multi-party one, and I raise that because it's important to note that the employee is responsible for facilitating the accommodation. Okay, and what I mean by that is the employees, if they have a substance use disorder, or if they have some disability requiring the use of a substance that may result in impairment, then they have an obligation to tell the employer that if it could cause a workplace issue. So if an employee is using medication that doesn't affect their work duties, there's not this overarching entitlement to information. But if their medication is such that it will impair them at work or could impair them at work, or if there is a substance use issue, there is an obligation to inform the employer and to provide information about their disability and to participate in reasonable employment accommodations, which in some cases can include participating in a rehabilitation program before returning back to work. If the employee does not do that, then employers have been found to have been relieved of their duty to accommodate. You obviously can't know what you don't know. And that's not to say that an employer doesn't have an obligation to ask. There are instances where an employer is obligated to ask, but if there's no reason to believe or reasonable, basis to believe that somebody's either taking substances to control a condition that may impact their work performance or has a substance use issue, then it's the employee who's to engage and to initiate that accommodation process. Now, as I mentioned, if the employee does do that, the employer then obviously has to participate in the accommodation process. But you may, as the employer, have a duty to inquire if there is a disorder or disability or substance use issue that requires accommodation. It is not enough to turn a blind eye to what is otherwise obvious behavior requiring accommodation. So this may be an employee starts acting differently in the workplace. They start following certain patterns of behavior that are problematic, both with their work duties or working with others. They may, for example, start attending work, smelling of alcohol or making erratic statements or comments. Those are all indicators that may trigger an obligation for the employer to ask, are you okay? Is there anything that we should be aware of? Do you want to talk about the different, accommodation that may be available, et cetera? There is, it's not enough if those behaviors do present themselves in the workplace for the employer not to ask. It could very well be that they had an obligation to accommodate and didn't.
Diane, I just want to jump in and give you a 2-minute warning.
No problem. I'll skip Thank you. I'll skip the next decision that are in the materials, but essentially solidifies the point that this was a seasonal painter who was painting on the outside of high-rise buildings, and didn't disclose to his employer that that he used cannabis for medicinal purposes. He had a neck and back pain issue, and so he didn't disclose to his employer that he used medicinal cannabis for those purposes, and was found smoking cannabis at work, and the employer terminated him. And then the painter brought an application, and the tribunal said, no, you didn't inform the employer of the need to use medicinal cannabis for any disability. You didn't allow the employer to engage in that accommodation process. So unfortunately, the code hasn't been violated, and the application was dismissed. I also, though, want to highlight in the last amount of time that I do the Enbridge gas decision. And the reason I wanted to highlight this is because this sort of picks up on a conversation that you heard from the last panel about, it's not enough to place them in, say, the first rehab program. There is some obligation to accommodate relapses. In this case, and I'll just skim through it very quickly. In this case, the individual was a directional driller, and he actually didn't have any misconduct. He was driving to work and actually kept pulling over to use cocaine. And by the time he got to work, he self-reported to his supervisor, I'm in trouble, I messed up, and sort of broke down. And the supervisor and the manager immediately called his union, helped him, immediately arranged for a treatment program for him, would regularly visit him, checked in with him, sort of did all the things that you would want and expect to help with his treatment. He completed the treatment program, returned back to work with conditions about the work that he was able to do. He was also required to remain in an aftercare program. Turns out he wasn't, and then did show up to work impaired, and had been using cocaine and clearly relapsed. The medical professionals were all in agreement that he had relapsed. And in that case, the arbitrator said, look, the duty to accommodate requires the employer to bear some burden, not an endless one. It is to the point of undue hardship, but the failure to tolerate a single relapse did not meet the test of accommodating his disability to the point of undue hardship. There was some, I'll call it, forgiveness to be afforded to someone who otherwise did not have a disciplinary record, was the one who self-reported his issue, did fully comply with the treatment program, et cetera, and then returned and had a relapse. And so he was actually reinstated back to his employment, but with strict conditions about the obligation to participate in treatment, to regularly check in with his mentor, and he was subjected to random drug and alcohol testing for a period of time. So I wanted to highlight that one. So sort of as a final note, and I apologize for running slightly over time, I wanted to include some best practices. Give the individual an opportunity to participate in the accommodation process, ask questions, including if there's been an incident that's occurred in the workplace, require and allow them to provide medical information, providing information as to what restrictions they may have, what their prognosis for recovery is, what type of treatment programs could be available to that person to participate in. And there may be instances where we do have to accommodate even after, for example, the successful treatment program. And I will highlight, as I always do, document, document, document. I know that's a very lawyer thing for me to say, but when we are conducting these investigations, when we're having these discussions, we want to be able to demonstrate the efforts that have been taken in what is undoubtedly a very difficult process.
Thank you so much, Diane, for sharing that presentation with us. We're always happy to have you here, and you're always sharing such a great legal update. So thank you again. And I'm going to pass it over to Yasmin now, and she will introduce Minister Tabolo.
Thanks, Meredith. For our last key speaker, we do have Minister Michael Tobolo, the Associate Minister of Mental Health and Addiction. Minister Tobolo proudly serves the people of Ontario as the first Minister of Mental Health and Addictions and has continually made it his mission to create a connected system of care with a comprehensive wraparound services so every Ontarian can fully be supported in their journey towards mental wellness. We want to thank you, Minister Tobolo, for taking great strides you've achieved and we are continuing to work towards. So thank you for being here today. We appreciate it.
Thanks, Yasmin. You can hear me, correct?
Yes, we can.
Perfect. Well, thank you for inviting me again to this. It's becoming a tradition for me to come and speak to the group, so I really appreciate it. I keep on telling people I've either not said enough, and so you need to have more of me, or you have a real keen interest, and I think you do have a real interest. I listened to a little bit of the seminar. I got out of cabinet a little early, so I listened to a little bit, and it's great to see that you're looking at things that can be done. For me, it's a great opportunity to speak to you about a really important topic, and that's mental health and addictions in the construction industry. Being of Italian origin, I worked a lot in the summers as a kid in the construction industry, and that's how I paid my way through law school, and that's how I learned a lot of the skills and the determination of so many people to to build that resilience and to be able to move forward. And we know that the construction industry is vital to the success of the economy of the province of Ontario. The people that work in the construction industry, the men and the women, they build our infrastructure, they connect us with the infrastructure, the homes that they build. And it's really fundamental and foundational to the growth and prosperity of the province. Again, billions of dollars are generated through the economy, the construction industry into the economy, and hundreds of thousands of skilled workers work in the industry. I always use a couple of statistics, and I want to sort of lay them out there so that you understand how prevalent mental health issues are, and addictions for that matter. 200,000 people in the province of Ontario don't go to work every week because of a mental health or addiction issue. And last year, this would have been 23, not 24, we lost 500 construction workers to fentanyl overdoses. And so when we talk about mental health and addictions, it's not just homeless, it's not just people that are suffering from and perhaps are marginalized. It's also people that are earning, hundreds of thousands of dollars, have families, have homes, have mortgages. And so this is an issue that's extremely important to absolutely everybody in society. Again, for me, the mental health and well-being of the people that are building the infrastructure, for the rest of us, their well-being is extremely important to a successful economy. And so today I want to talk a little bit about the mental health and addiction challenges that face the construction industry, the factors that contribute to the issues, and the resources that we have available either through government programs or otherwise, and the steps that the Ontario government is doing or making and trying to support the critical work that's being done by this workforce. Before I get into specifics of what the government initiatives are, I want to share an experience that I had. Again, I don't know how much people know about me, but my background, I practiced law for 30 years, started volunteering at a rehab center, a residential therapeutic community for men. And the men that were there came from all walks of life. The one issue, you couldn't get there unless you could afford to pay to be there, because again, long-term residential therapeutic communities in previous governments were not funded. So the only people that were coming in, they're the ones that could afford it, or the ones that were subsidized as a result of philanthropy and fundraising that the organization used to do. But I met one person while I was there, met many people, but one person stood out to me because it was an individual that was 50 years old at the time. I'm going to just call him James for the sake of calling him. I'm not using his real name. He was addicted to a slew of different substances: alcohol, marijuana, crack cocaine, heroin, codeine. And he had 3 children, and he worked as a laborer in the construction industry. So you might say, not typical employee, like not a typical person that you would suspect to have these issues going on. But he came to this center and he spoke openly about the struggles he'd had. His words have been with me really and drive me, because I know there's so many other people like him that have had this situation happen to them. And again, in this line of work, I was 18, 19 at the time, and I could move mountains. The strength and the resiliency that you have as a young person, your ability to recover. But over the course of time, that changes. And over the course of time, that doesn't change the demands and the long hours that you have to put in. And so, unfortunately, things happen, and you have back pain, you have potentially injuries, and it's easy to look to painkillers to assist you, to help you deal with those things, because again, you've got issues that you have to deal with: children, mortgages, and everything else. But if that's not managed properly, those types of situations can spiral out of control and could become a dependency. And so with him, when I was talking to him, he would talk to me about the shame and the isolation that came from being an addict. And he said that to me, I felt like I couldn't talk to anyone about what I was going through. And I was afraid my coworkers would think I was weak, and I didn't want my family to worry. So think about all the pressure, of having to achieve something every day, not wanting to let down the people you work with, your family, having to cope with all these issues each and every day, and being afraid to talk about it because of stigmatization associated with an addiction. And so he explained to me that, it started affecting his life. He eventually lost his job. The family, for him, it was difficult because he couldn't support his family. But notwithstanding that, he was determined that he wanted to get his life back, and that's why he went into treatment. That to me is something that I know exists in every individual. No one wants to be an addict. There's usually an underlying reason. Unfortunately, physical pain and the improper use of opioids, we know, has really created and caused the epidemic that we're going through, because it continues. But again, yeah, under the circumstances, he as an individual had to deal with all these different things, felt alone, felt isolated. I know the situation's changing today. Just this conference alone, listening to some of the discussions that are taking place, how even it's handled through with the legal system, and utilizing every effort possible to keep that person working and engaged, talking about the illness. I think we are starting to make some very positive moves forward. Have we done enough? Absolutely not. Early on, I think I popped in around 2:35 or something, and someone was talking about women or men's mental health. And, men's mental health and addictions is an area that I'm very familiar with. What's happening now that's really scary for me is that we're getting just about as many women with addictions as we have men. And many times these women have children. And so the complexity of the issues that have to be dealt with are that much more complicated, that need that much more attention. And that's where we need to do a lot more in terms of expanding supports and services, because in effect, guys were the addicts before, and all the programs that you see were built around the needs of men, not women. And women are even more susceptible to overdoses and to addiction than men are because of physiological differences. But and again, why is this important to the construction industry? Every time I go to one of the unions that they're graduating carpenters or masons, or I see more and more women. And so the concern is, this is going to become potentially another epidemic, and we've got to get ahead of it by ensuring that we build not just the places to assist women, but also to ensure that our policies are now wide enough to understand the differences and how do we handle situations where someone could be a mom, doesn't want to lose their child, and therefore doesn't talk about her addiction. What are we going to do in those circumstances, and how do we go about fixing that? And again, because of the number of women coming into the construction industry, I'm really concerned that we are not focused enough on that and need to pay more attention to that. And certainly as government we are. And, I unfortunately couldn't participate earlier, so I don't know whether you got into the discussion about women in construction having to deal with mental health and addictions issues, because it is definitely an issue that
We didn't talk necessarily specific to women, to be honest.
So just to flag that then for you, perhaps for the next rendition of the of this conference to add something in, because we certainly are looking at it from a government standpoint. But again, when we talk about the individuals, and James, the guy that I was talking about, that resiliency, how do we build that confidence into the individual, the hope in the individual, to ensure that they are able to deal and ask for help and get that support that they need? And that to me is extremely important. And a lot of it has to do with the work that you're doing. The more you talk about it, the easier it is for people to come forward and recognize the fact that situations like this happen and they're not insurmountable. But it means that we need to work harder and better to coordinate and to create low barrier access points for people to get to programs that will help them. So for us, from the standpoint of what we do, or what I'm trying to do, is to try to understand what the unique needs of people that are in construction are, because they are unique. Their challenges are different than they would be for other people. Construction workers have a high pressure environment. They're physically strenuous jobs that require the individual to have to deal with tight deadlines and manual physical labor. And coupled with the fact that the jobs, the way they move, the way they're structured, they're transient in nature, they're long hours, they're many times individuals away from the family, and all these different things contribute to significant mental health challenges. We've seen studies that show that construction workers are more likely than those in other sectors to experience mental health struggles, including anxiety, depression, and substance use disorders. Tragically, this has led to higher rates of suicide within the industry. Now, what contributes to this? And so to better understand how these challenges arise, one of the things I'd like to look at is what the key factors are. First is the construction industry is a male-dominated industry where strength and resilience are often seen as the norm. And this culture can make it difficult for workers to admit to struggling or to seek help when they need it. And again, that is one of the most significant issues. The physical demands and the pain associated with the kind of work that's being done. This pain can lead to the misuse of prescription medications or other substances to cope with those problems. Job insecurity and economic pressures. The nature of the construction often involves temporary contracts and seasonal employment, creating financial stress that can exacerbate mental health issues. Isolation and loneliness. Workers that are on remote job sites or long-term projects often experience isolation, being separated from families and their support networks. The opioid crisis has hit the construction industry particularly hard, with workers disproportionately affected by opioid-related overdoses. And the physically demanding nature of the work and frequent injuries contribute to this vulnerability. The stats, as I mentioned, are alarming. Suicide rates in the construction industry are significantly higher than many other sectors. A construction worker is actually 6 times more likely to die by suicide than from a workplace accident. And substance use, particularly when we talk about opioids and alcohol, is prevalent among construction workers, often as a way to cope with that physical pain, stress, or emotional struggles. Chronic pain from workplace injuries can lead to dependency on painkillers, which may spiral into addiction without proper support. Now, what can we look at? What can we do? Are there other ways that an individual can cope with these types of things? And again, this pain management issue. One of the major challenges that's faced by construction workers like James is the management of the physical pain caused by years of strenuous labor and injury. Too often, the painkillers and the opioids are seen as the first and only option. And while these medications can play a role in recovery, they also carry extreme risks, including dependency. Now, I'm not a medical doctor and I can't give advice when it comes to this area, but what I can tell you is that there are alternative approaches to dealing with pain management that can be effective without the risks associated with those, with the use of drugs. And these natural remedies not only provide relief, but also overall well-being. Today, I want to emphasize the importance of exploring these options as an alternative and encouraging workers to find safe, suitable ways to cope with their pain. Physical therapy and exercise. Again, physical therapy can be incredibly effective for managing chronic pain. There are techniques like stretching and strength training and targeted exercises that help rebuild muscles and reduce strain or injuries. There are many workers that utilize, physiotherapy as a way of coping. And this, again, is often covered by workplace benefits. Massage therapy and acupuncture, without getting into a lot of details, because you're aware of them and there are things that can be used, heat and cold therapy, yoga and mindfulness practices. One of the things that I found fascinating in my work was spending some time in India studying Ayush, which is a combination of a naturopathic medicines called Ayurveda, meditation, and yoga. And I sat across, which was fascinating for me, a group of doctors trained in Ayurvedic medicine and a group of doctors that were trained in the West. And what they did was explain how the two complement each other and how, for instance, pain management could be reduced utilizing things like yoga and meditation and naturopathic medicine, the combination of the three. That was really interesting to me because they started talking about in the West doing knee and hip replacements at the age of 60. And anyone who knows about knee and hip replacements, if you do it at 60, chances are you're going to have to redo it at 80. And in utilizing Ayush, Ayurvedic medicine, they were able to prolong the period of time that the person was healthy and not in need of a knee or hip replacement to the age of 80 by keeping and managing pain naturally. So there's a lot we can learn from places like that have incorporated these again, we call them new, but they've been around for 5,000 years. So when I hear about this, and I see huge benefits to us by looking at these perhaps non-traditional ways of managing pain. Nutrition and hydration are also issues that we really need to make sure are addressed as well as a way of dealing with and coping with situations where people are suffering from pain and related to the work that they do. And also encouraging a supportive environment, which is, I think, probably given today's seminar and the work that everyone's doing, extremely important. I think if employers understand and value their employees and underscore their mental health and how it relates to their physical health, at the end of the day, it makes the company that much more successful and healthy from a business standpoint to be able to do the work that they're doing, because you're relying on these people to not only do their jobs, but ensure that they're training the next group of the next generation of employees. I've always said that at in our meetings at cabinet when we talk about the economy. Losing 500 construction workers might not sound like a lot, but when you think of the cumulative knowledge of these individuals and the fact that it's lost to the sectors that they work in, who's going to train the new individuals that are coming up if we're losing that significant a number of people with years and years of training? So in the end, inevitably, the economic outcomes for those companies and for our economy will be substantially less. So it's critical for the government to underscore and work to ensure that we build the best systems possible. So doing things like promoting wellness programs, which is something that I know you do and you've been talking about, I think it's extremely important. Encouraging an open dialogue, again, extremely important. If a person feels comfortable and shares how they feel and is able to not be seen upon as a weak link, but as someone who is an important part of a team, and the help is there to help that individual, I think that really builds an incredibly strong team that's able to do that much more. And then, for the employers and the unions to be able to provide resources, information, support groups, workplace resources, peer support workers, having someone who's gone through the system and is now, reintegrated back into the workforce, to be able to have someone like that for an individual to talk to. These are extremely important. So, where can we get help? What is the government doing to help the construction industry? We're doing a ton of stuff. I'm proud to be the first minister in Canada, the first in the province of Ontario, to be named the Minister of Mental Health and Addictions. It's a recognition by our government that mental health and addictions is a critical part of everything we do in society. There's 16 ministries that invest in mental health and addictions, but there's never been a line of sight. There's never been coordination. There's never been someone to focus and ensure that the programs are there to help everyone, from the young children to our seniors to our workforces and all the specialized groups that live that within our society, within our community, that require culturally appropriate care. These are the things that my focus is on. And so for me, when we talk about what are we doing, it has to be culturally safe. It has to be readily available to individuals. The pandemic may not have been the best thing for us as a province, but I always look for a silver lining. And the silver lining is that we learned a lot about communicating. Like, look at this meeting. It's being done virtually. There are a lot of virtual supports, and there are a lot of studies that support the treatments that we have instituted via the internet or via programs that assist in providing those supports to individuals. So we have helplines. We have the kids helpline. We have helplines for adults. We have them in, I think, 54, 56 languages. There's crisis services that are available through Connects Ontario, ontario.ca/mental health. That page is loaded with different types of programs and helplines, and to make connections and to assist individuals get the help that they need. We also have employee assistance programs. Many employers offer the EAPs that provide confidential counseling and mental health resources. And these programs are an amazing step forward for workers to seek that help. Community-based supports, local mental health clinics, addiction treatment centers, peer support groups, all of these offer accessible, tailored care to the individuals. Programs like Rapid Access Addiction Medicine, the RAM clinics that I'm sure you've heard of that we have around the province, as well as many workplace mental health initiatives that have been organized via the Canadian Mental Health Association, Workplace Safety and Prevention Services. These are offering training and resources that foster mental health awareness and resilience building in the workplace. As well, the work that is being done with the unions. Many of the unions are now prioritizing mental health by providing access to resources, peer support networks, and educational programs. And if you're part of a union, take advantage of those initiatives. I can tell you that, in the construction industry, between LiUNA and carpenters, I spent a lot of time talking to and working with both unions to make sure that we build a system of care that's focused on the needs of the specific industries. Because again, we know a one-size-fits-all approach doesn't work. What we need to do is we need to address the needs of the individual, but also look at what the needs of the family are. Because the implications are that you help the person, but if you're not helping the family, and there's an environment that's not allowing that individual to heal, then the person will not heal. And so there are things that we have to do with that. Under the roadmap to wellness, we've adopted a continuum of care approach. We're interested in looking after the individual throughout the lifespan, understanding what those needs are over the lifespan, and making sure that the treatment, recovery, and supports are there and built in a way that they meet the needs at the level of the individual where he is in that lifespan. And so we're addressing this by expanding mental health and addiction supports. I think you've all heard me talk about the $3.8 billion we're investing to expand the base of the work that we're doing, the targeted supports that we've built in and support in the construction industry to make sure that we have the supports that are there that are necessary. And this includes things like on-site mental health support through mobile clinics and peer counseling programs, partnerships that we have with employers to integrate mental health training into the workforce safety protocols. And to address the opioid crisis, we took a strong position on this, expanding the availability of naloxone kits to prevent opioid overdoses, increasing funding for different harm reduction services, enhancing access to addiction treatment programs that include the withdrawal management and long-term recovery supports. We also are working to try to reduce stigma associated with mental health and addictions issues. And we're trying to ensure that we have low barrier access points for people to be able to get the help they need and feel safe about getting it, and ensuring that they are looked after as early on as possible. And we're collaborating with different organizations, construction employers, unions, industry associations to foster that culture of support. And we have initiatives that include mental health first aid training for supervisors and managers, encouraging companies to adopt mental health policies, such as offering paid mental health days and flexible work arrangements, developing return to work programs that support workers recovering from mental health challenges or addiction. And I think that what's important is the government is committed to leading this effort. We can't do it alone. Employers and unions, communities, all have a vital role to play in ensuring that we build a system that supports people's mental health in the construction industry. And employers can foster a culture of openness by prioritizing mental health in the workplace. And that includes training managers to recognize the signs of distress, creating policies that support work-life balance, and ensuring workers have access to resources when and where they need them. Unions and industry associations can advocate for comprehensive mental health coverage and benefits packages and organize training programs that empower workers to support each other. And in the community, we can offer support by ensuring that mental health and addiction services are accessible to everyone, including those that are in rural and remote communities. For us, the way forward is to address mental health and addictions in the construction industry, which is something that has to be a focus of our attention. We may not be able to fix it overnight, but if we start addressing it, we will start building a system of care that will build over time. It requires a sustained effort, a collaboration, and a commitment to creating real and lasting change. So opportunities like this to identify gaps, to speak about the development of programs, listening to what the real issues are on the street, not what is going on at Queen's Park and what we think needs to be done, listening to the industry, listening to the employers, and most importantly, listening to the employees and the families about what the needs are, and meeting those with appropriate policies and appropriate dollars to back the changes that need to be made. I'm confident that together we can make a difference. I know there's employers that are with us. Make mental health a priority in your workplace. When you stop and think about the economy, and this is a conversation that we have at the cabinet table all the time, we pat ourselves on the back, and we rightly so, because we have created a ton of new jobs, over 800,000 new jobs. But I always ask the question, as happy as we are that we've created these jobs, are we measuring the productivity of the individuals? Because if the individual doesn't have mental health, he isn't going to be healthy. And if he's not healthy, he is not going to contribute to the full extent possible. And that's going to be an implication to the economic success of the business, but for us, the province. And if we fail, we all fail. So mental health is health. Health is key to a healthy economy. And for us as a government, we're extremely interested in building not only the infrastructure that's going to get us to work faster and move goods safely across the province and into other markets to generate more income for the province, but also the infrastructure necessary to ensure that our people are healthy, are safe, and productive individuals that return home and enjoy the fruits of their labor each and every day. So I'm going to end it there. I can talk for a long time on this topic because it's become a passion of mine. And I have to say that I am incredibly honored to be included once again in this ResCon event because it means a lot to me, having come from the construction industry, having many family members that have worked and continue to work in the construction industry, and knowing how much they contribute, but also the price they pay each day going to work, contributing to the building of the province, and going home a lot of times broken and tired and needing help. So thank you, all of you, for taking the time to talk about this very important issue that not only is close to me, but I think is close to a lot of all of you as well, because you're all here and you're all listening. So thank you, and I appreciate the time.
Thank you, Minister Tabolo. We are very grateful that you took the time to come and speak at our 6th annual Mental Health and Addictions webinar. We're very grateful. You've done incredible work so far, and we look forward to seeing what you continue to do in the future. Thank you.
Thank you. Did I burn the Q&A time? Is that what's happened? I've talked too long?
We're just going to wrap up now. If we do have any questions, we can let you know, and
Please.
we'll forward them to you as well.
Please.
But I
Thank
just
you.
want to take the time to thank all of our speakers and panelists today. Each of these conversations helps advocate and push towards making a stronger, more inclusive construction industry. As we've highlighted throughout our panels and keynote speakers, the state of mental health in construction has always needed to be improved and has continued to improve in terms of breaking the stigma surrounding mental health, not only in the construction industry, but also in our everyday life. Highlighted through the training programs that we were mentioned today. All these resources will be available in our post-event summary, and just a few housekeeping notes. So our post-event summary will be sent out in a few days. That will include all the resources and the recording of this webinar. And so with that, I would just like to thank everybody who is a part of this ongoing conversation to help reshape and work towards creating a better, more inclusive construction industry's approach to the mental health and addictions. So thank you, everybody.